Welcome back to Good Things Utah on this Friday, talking now about helping us reach our overall health goals in this sponsored interview. Chief Physician Executive Dr. Chad Bittner is joining us now to share how Optum is stepping up to care for their patients. And I think what you and I have been talking about is you really just don't need a doctor when you're sick. It's all the time.
Right. So we want to focus on you when you're well to keep you from getting sick. And of course, if you're sick, we want to focus on you when you're sick to make sure we can get you well.
So what do you want Utahns to know about the kind of care that Optum provides?
Yeah, so you choose your health plan, and if Optum's part of that health plan, we offer more than just what the benefits are in that health plan. So we are a bunch of doctors, nurses, pharmacists, etc., helping to help drive the care that you get, and also providing information to your doctor so they can make decisions that are even better for you.
It's a team. It takes a village to be healthy, right? And
yeah.
You've got everybody working together for your patients. What do you mean when you say you're focused on your whole health?
So whole health, like I said, when you're sick and when you're well, we want to focus on all of those things. But it's not just your physical health, but we also want to focus on your mental health as well, because we know that you can't separate those two. One affects the other. And so we work with your doctor, providing information that your doctor may not even know, because we have so much access to information about you, about what prescriptions you're taking, what doctors you've seen in the past, et cetera, to make sure that your doctor gets a full picture of you to make the right decisions for you.
Has mental health become even more important since the pandemic? What have you noticed?
Oh, absolutely. Mental health has become extremely important. Access to care for mental health services during the pandemic was an extremely important thing to do, and that's why we ended up having virtual visits that can supply some of that care, not only now for your mental health, but also for your physical health.
So aren't all healthcare companies doing the same? What makes Optum different?
Well, there's a lot of similarities that we do that other healthcare companies do, but what we do is we bring that whole top to bottom approach to providing your care, which means that we have all those people I talked about, the doctors, the nurses, and the pharmacists, working behind the scenes on your information to provide that information to your doctor so that we can make great decisions for you for the best outcome possible.
Okay, how does that work in practice?
In practice. So we are communicating with the doctors and providers on a regular basis about the patients that they have and bringing that information to them so that things they may not even know about. So we bring things like data from your pharmacy claims, from radiology reports that doctors may not have access to say, hey, your patient may have these other things going on that you're unaware of, and let's work together to make the best decision.
It's this top to bottom approach. Can that even save you money in the long run?
Absolutely. So prevention and early identification of health issues can really prevent long-term cost as well as deterioration in your health. So it can help prevent you from paying for things that could have been avoided.
All right, can you give us an example? Like, talk us through the approach.
Well, so if you choose Optum as part of your health care, we are letting you know that we have several different programs that are available to you. We have community centers that we have in the market here along the Wasatch Front that allow you to have social action, direct care from some of our providers there, and also classes that help you focus on your health.
Dr. Bittner, coming out of the pandemic, what are you noticing? What do we need most of all now in 2023?
Well, I think coming out of the pandemic, we are needing to make sure that we are focusing on the things that got missed during the pandemic because access to care was limited because of the pandemic. And so a lot of those things that were missed, we're having to pick up on right now to make sure that we're getting the best outcomes on those things.
You mentioned community centers. What happens at those?
So community centers, we do wellness visits there to help make sure that you're getting all the things done with your doctor you need to get done, and we communicate that information back to your doctor. But also we have lots of classes that occur there. So we have a dietitian that can help you with dietary concerns. We have exercise classes. I think our biggest class that everybody loves to do is Zumba Gold, which is a kind of a senior-focused kind of Zumba class.
How important is that interaction and that connection? Oh
man, social connection is so important to make sure you maintain your overall health and that you're focusing on not only your health needs but also your social needs.
Optum.com/Utah, everybody. If you want more information, they also have a phone number. If you have questions, you can call 801-982-3885. And our thanks to Optum for this sponsored interview and Dr. Bittner for stopping by.
Thank you very much.
Good to see you.